The setting: a quiet courtroom in the U.S. District Court for the Northern District of Texas. The key players: David M. Young, MD, defendant, Assistant U.S. Attorneys Bryn Sheese and Ethan Womble, prosecuting, Brantley Starr, U.S. District Judge, on the bench, with special guest star Pamela Edwin, the former office manager of a now defunct Florida telemedicine company, Sunrise Medical, Inc. All eyes were on Pamela Edwin as she took the stand in the trial of David M. Young, MD, accused of participating in a scam involving $70 million in fake Medicare claims for orthotic braces and genetic tests, in concert with, among others, Stephen Kahn, Sunrise Medical's owner, and Matthew Harrington and Michael Spear, marketers and patient recruiters. In testimony seemingly lifted from film noir, Ms. Edwin testified against Dr. Young, stating that, quote, "If I sent him 25 prescriptions, within 20 or 30 minutes, they were signed." She explained that many of the prescriptions were pre-filled by Sunrise's non-medical employees who were, quote, "hookers, drug addicts, and some regular people." On May 24, 2024, a federal court jury convicted Young, 61, of Fredericksburg, Texas, of 1 count of conspiracy to commit healthcare fraud and 3 counts of false statements relating to healthcare matters. The jury found that Young had signed thousands of medical records and prescriptions for orthotic braces, genetic tests that fraudulently represented that the braces and tests were medically necessary and that he had diagnosed the beneficiaries and had a plan of care for them and recommended that they receive additional treatment. The fraud impacted over 13,000 Medicare beneficiaries, as well as several undercover agents posing as beneficiaries. Many of the 13,000 patients were never seen, spoken with, or otherwise treated by Dr. Young. In return for approximately $475,000 in ill-gotten gains, the fraudulent prescriptions were passed along to brace supply companies and labs, which in turn billed Medicare more than $70 million. Young's real payoff is the up to 25 years in federal prison that he's now facing, with sentencing to take place at a later date. Healthcare fraud is far from harmless. Fraudulent activities drain billions from healthcare programs like Medicare and Medicaid, leading to higher taxes and less money for other important services. The fraud often results in patients receiving unnecessary treatments or tests, which can cause real harm and stress. Healthcare fraud breaks the trust patients placed in them, making people more skeptical about the care they receive. And as Dr. Young will likely soon attest, those convicted face long prison sentences, potentially heavy fines, and ruined professional reputations. Although healthcare fraud doesn't require the involvement of telemedicine, with advances in telemedicine come advances in criminal schemes. It's rare that a physician is the criminal mastermind. Often they're caught up in the real mastermind's web, but that doesn't make the physician a victim. It makes him or her a co-conspirator. In closing, here are some takeaways for you, yes, you, to consider. Any deal must be structured in compliance with the federal anti-kickback statute, Stark, and various state law counterparts, and other restrictions. Money. Big money is tempting. I know because I've counseled many clients in connection with telemedicine ventures, paying what they must have thought was money from heaven. Yes, telemedicine has many valid applications. Violation of the anti-kickback statute and committing fraud are not among them. And the money's not from heaven, it's from hell. Let's talk before you consider any telehealth or telemedicine arrangement.